balloon catheter inductions, this is part 2. This just goes purely through what Cook's balloons are, it doesn't go through any other induction method. There are 3 parts to an induction of labour. One is the cervical ripening. This is where the cervix needs to be open up enough to be able to break the waters. This is often the longest part of the induction process because that can take sometimes hours or days to be able to get to that point. Then there's the breaking of your waters, so the amniotomy, that's where the water's broken. And then there's the hormone drip after that. Some women will only need one part of that induction, others will need the whole shebang. Now, catheter inductions, there's either single balloon or double balloon. Double balloons often work a little bit more effectively, they inflate a bit more, so they actually get the cervix to a much better starting point for breaking waters and hormone drip. But not everywhere offers double balloon catheter inductions. So what will happen as a starting point, you'll have your assessment, your observations, midwife will feel your tummy, do a monitoring of your baby's heart rate, make sure everything is okay. They will often put your legs in the air because it makes it easier to find the cervix, bring it forward to be able to insert the catheter balloon. And if it is a double balloon catheter, then there is a stylet that just helps introduce it into the catheter that's then removed. And so the silicone balloon is all that's left, soft and squishy at that point. Gas and air is your friend. I highly recommend you have gas and air with this. Lots of people won't need it. I've seen lots of women who are absolutely fine with it being inserted, not a problem. These tend to be women who've had babies before where the cervix is still slightly open, so the discomfort for those women is less. If this is a first baby where the cervix is really far behind the head, really long, really posterior closed, this is where that discomfort can really happen during insertion. Insertion on average takes about 3 to 5 minutes, can sometimes take a bit longer if the cervix is really posterior. You can ask to pause, you can ask to stop, ask for a break at any stage if it is that uncomfortable. So what will happen is the midwife will examine the cervix, see where it is, find out how open dilated it is, find out if you even need a catheter balloon at all. Because if your cervix is already open enough to break your waters, you've already missed the cervical ripening stage. I also recommend things like acupuncture, breast milk pumping. If you know you're having an induction, you've chosen to have an induction, you've looked at all the benefits and risks of induction. Dates are also a great way to open up that cervix a little bit more as well. And of course, gestation can make a difference as well. Someone who's 36, 37, 38 weeks pregnant is less likely to have a slightly open cervix compared to someone who is sort of 40, 41 plus weeks. And as always, there are 2 books I recommend, In Your Own Time and Inducing Labour by Sarah Wickham, to have a read before deciding whether an induction is right for you or not. So your legs are on lithotomy, the midwife has examined you, and what will happen is there's usually 2 people there to help support. What will happen is the stylet is introduced whilst the midwife is digitally bringing the cervix forward, it goes through. Then what happens is there's some salty water that is inflated through the balloon that inflates the balloon in the uterus. This one is not usually uncomfortable for any woman. This one they tend not to feel, and it feels more comfortable because the stylet is now removed as well. So it is just that soft squishy silicone at that stage. The part that causes the discomfort is often the vaginal wall balloon. So the maximum that the balloons can go up to is 80 and 80, so 80 mils and 80 mils. It is the vaginal balloon in the sternal os of the cervix itself. It's this that often causes the pain and discomfort. And this is where it needs to be titrated to your comfort levels. Highly recommend that. If it starts to feel uncomfortable, you might feel pressure. It feels a bit like a baby's head is coming down into your pelvis. But if you start to feel pain and discomfort, because there's so many nerve fibres in the vagina and at the base of the cervix, that's often what causes that discomfort, is as this one is inflating. If it gets to the point where it's painful, tell your midwife to stop inflating the vaginal wall one. The uterine one can continue to be inflated up to the maximum of 80 mils, whilst this only stays at maybe 20, maybe 30 mils, whatever works for you. Some women will be absolutely fine with 80-80. It's not a problem or concern. Some women will be absolutely fine initially, but maybe because their bladder is filling up and that bladder is putting pressure on the vaginal wall balloon. Sometimes this just needs deflating at a later stage. So if you're starting to feel pain that you hadn't felt earlier, go and have a wee first, make sure that you empty your bladder, because a full bladder will mean that you're more likely to feel pain and discomfort in the double balloon catheter insertion. And that can be deflated at any stage should you want or need to. You can have pain relief at any point as well. Paracetamol, dihydrocodeine, pethidine. You can have a TENS machine, for example. And when this is in, the more mobile you can be. So think birthing balls, think peanut balls, think going up and down stairs, trying to really help things move along. But basically what happens is the double balloon puts the pressure on the cervix, thinning it out, making it smaller, making it much softer, much more effaced. And if it's at 80-80 and it does fall out, that means your cervix is 4 centimetres. That's a brilliant start to having your waters broken or having the hormone drip. 20 mils in the uterus is equivalent to 1 centimetre, 40 is equivalent to 2, 60 is equivalent to 3, and 80 is equivalent to 4 centimetres dilated. That means you're going to be starting active established labour at a much better part. That means hopefully the hormone drip won't take quite so long to be able to become effective either. Whilst it's more common to go into labour after prostaglandins because of the uterus contracting so much, some women find that just by getting their cervix to 4 centimetres, their body starts to take over and they start going into labour themselves. Not as frequently as after the prostaglandins as a method of induction, but some women do go into labour after having a Cook's balloon inserted. And it does save women a lot of time in the induction process. 69% of women will be able to have their waters broken after only 12 hours of the catheter balloon being in place. A double balloon is less likely to fall out than a single balloon as well. So if it falls out, it usually means your cervix is open to a really good level in a double balloon. With a single balloon, sometimes it can fall out at sort of 1 to 2 centimetres dilated, and it can shrink up after that stage, meaning that you might have to think about other induction method processes. 90% of women report a positive experience with induction of labour with a double catheter balloon. There is much less time in hospital as well. Because your waters can be broken within 12 hours, for example, it means that you're not in hospital for 2 or 3 days even before you've got to the point of labour. You're not shattered, you're not exhausted, you're not being poked and prodded every few hours. Like, it's a much more positive experience for women who need an induction of labour. Lots of trusts also support women going home with the Cook's balloon as well. So what it means is that you're safer to go home. You can spend the night in your bed or the day in your bed. You don't have to be in a hospital. You can be in your own surroundings. And that comfort in itself boosts your oxytocin, it boosts positivity, it boosts your serotonin. And so that really helps with labour and birth, and it helps with your whole experience overall. It also means less sleep deprivation before you have a baby, so that you're in a much better place after your baby is here too. My favourite one is that when it comes to the point of breaking waters in the hormone drip, labour tends to be a bit slower than if you'd had prostaglandins, and that's great because it means you're in a more comfortable place, it means your endorphins can kick in as well. It means that you're going to feel much more positive throughout your labour experience and that you're not feeling so much pain at that onset. And in terms of the NICE guidelines, they did a review of this. The risks of this are the pain and discomfort on insertion. Blood on the point of insertion, and that's because particularly if you've got a long posterior cervix, sometimes it can cause a very vascular cervix. There's lots of blood flow to the cervix, particularly during pregnancy. It can cause it to bleed a little bit. That should ease after about sort of 5 to 10 minutes after it's been inserted. There's less hyperstimulation. Now, in the NICE guidelines, when they've looked at all of the available randomised control trials, they found that it's probably safer from a baby perspective than prostaglandins, from the fact that it's not going to cause the uterus to contract too much. And so women will be more comfortable, but also there's less likely to run to theatre with baby's heart rate being affected because the uterus is contracting too much. We all react differently to medications. I could give paracetamol to 10 different people and they'll all tell me different things, whether it's worked or not. Now, there's a couple of risks that are identified in the NICE guidelines for Cook's balloon. So one is the pain on insertion. Absolutely, that's a known risk. The other one is a small chance of cord prolapse. In the randomised control trials, there was about 1 in just under 2,500 births. So not a huge risk, but it's just to be aware of. It is also being aware that there was malposition, so the baby had flipped or had turned themselves into some funky position during the Cook's balloon induction process. That was 2 in just 2,500 births. So they are risks, but they're really low risk compared to all of the other more common risks that we've got in lots of different papers compared to prostaglandins.